Estoy aquí con el doctor Simpa Salami. Vamos a entrevistarlo. Él es urólogo oncólogo que se encuentra en Michigan. Hi, Dr. Simpa. I'm Fernanda Chain.
Hi, it's good to
I'm
meet
going
you.
to interview you today.
Sounds good.
So we were talking about this is your first time in Mexico.
Yes, it is. My very
And-
first time, and it's been amazing.
Okay. What are you liking the most here in our country?
In general, the people are very hospitable, very nice, and I've also enjoyed the very nice weather, and the beach, of course, is beautiful.
Yes, of course. And also you have to try the food.
The food was amazing. Yes,
Okay.
the food has been amazing.
So tell us about you. Where are you from? Where do you practice urology? And yes, tell us about you, please.
I'm from the University of Michigan in Ann Arbor, in the United States, and originally I'm from Nigeria. I did my medical school in Nigeria before moving to the United States in 2008. I have so far lived in Boston and New York and now Michigan for the last 9 years.
Okay, so you came from long, long away.
That is correct.
And well, where did you did urology oncology?
I did my urological oncology fellowship at the University of Michigan between 2015 and 2017 and joined faculty thereafter.
Okay, and you do robotic surgery also?
Correct. My clinical practice is focused on robotic surgery for prostate cancer and kidney cancer. I also spend some time doing fusion biopsies for prostate cancer detection.
Okay, so could you tell me which is your favorite procedure in urology, like general urology?
I would say kidney procedures, partial nephrectomy or total nephrectomy. And the reason is because, one, I did a lot of that during residency.
Okay.
I trained with one of the pioneers of laparoscopy, Dr. Lou Cabusi. And then the other reason why I like kidney surgery is because of the anatomy. It's beautiful anatomy.
Yeah,
I
for
just
sure.
enjoy it.
It's really cool to do renal surgery.
Yes.
So, and well, apart from the urology, what do you like to do, like in your day?
Yeah. When I have the time, I like sports. I like watching sports and playing sports. Specifically, I like soccer. So I follow a lot of the international leagues like the European Champions League and the English Premiership League. I also play soccer as well. And I also play video games. I play
Okay.
soccer video games as well in my leisure.
So, how often do you do something else about than neurology?
Um, well, beyond urology, I think one of the things I like to do is also traveling.
Okay.
And I'll admit that I do combine that with urology. For example,
Okay.
like when I go to conference, then I travel as well at the same time, oftentimes with family. you know.
Okay, but I mean, like you all the days of the week you have to work, right? So how often do you do something else than urology? Like you play soccer once a week
Yeah.
or maybe once a month?
Yeah, I'll say maybe about once a week. Usually on the weekends that's what I'll do. I work like 5 days a week, Monday to Friday, and maybe once every 3 months on the weekend I have to work.
Okay.
Take calls. Other than that, I have the weekend that I explore
You can do
the
whatever
town,
you
wherever
want.
I want. Yes.
Okay, so what would you like to say to the young urologists that are like in residency or maybe that are starting to work like in their practice? What advice would you give them?
Urology is a fun specialty. It's
It
a
is.
specialty where you would agree with me. It's a specialty where you can have fun doing a variety of things, whether you like benign urology or oncology, or you like endourology. There are different subspecialties that people can be exposed to, and you have fun doing them. Urology is very satisfying. That's one of the reasons why I went into it, because you can actually take care of the patient and see the results like almost instantly. I do cancer surgeries,
That's true.
and oftentimes when I do take a tumor out of a patient with kidney cancer, and it
You
comes,
try to cure.
the patient, oftentimes is cured. Of course, there's always a likelihood that it can come back, but that satisfaction of being able to help another person. Then the other aspect of urology that I think is really nice is multiple opportunities to do research, which is one of the advice I'll give to young up and coming urologists is, even if you're in private practice or at a smaller institution, to think about what kind of research can I do. And the reason why is because you can treat one patient and impact that single patient, but the findings from research can impact multiple patients, not just where you practice, but also across the world.
Yeah, I agree. So thank you so much, Dr. Simpa. It was really nice to talk to you.
Likewise, thanks.
And we hope you return to Mexico City and for a longer time.
Absolutely will do.
Okay.
Thank you.
Thank you.